I don't think my journey is very long. It's pretty short in joint replacement, as well as my presentation will also be very short. So I started joint replacement surgeries in 2010 in Choetham Hospital. When I joined Choetham Hospital in 2010, I started. The first patient was a valgus knee. Fortunately, it was a correctable deformity and it was easy for us to do it. And that patient, we have followed her for 13 years, and then till she survived. And she was a public prosecutor in West Bengal, and she was performing her duties on all court activities without any problem. So that encouraged us to do joint replacement further, and I took my formal training of arthroscopy and joint replacement from the Arthros Clinic for Zion. So they had two centers, and at the time when I was there in 2010, they used to perform 40 to 50 surgeries per day. Most of them, about 80% were arthroscopy and 20% was the joint replacement. So they had two centers in Pforzheim. It's a place near to Stuttgart in Germany. And this is our first unit. First unit I worked with, it was our Ortho Unit 2 in Choetham Hospital. Dr. Manoj Dubey and Dr. Surya Prakash Nagaria were my members, and we performed and we many surgeries over there, including the overseas patients which used to come in Choetham from west of the Africas. So in 2013, I got a chance, and Dr. Wolfram Klug from Germany came there to perform a navigation knee replacement in Choetham, and we had a program over there. He performed a bilateral total knee replacement, and after that, seeing the surgery and assisting him, I got motivated, and then I took my training for navigation in Singapore, and then in 2014 I bought a navigation system. It was a kick navigation system. Before that, this system in the city, there were already 4 or 5 navigation centers were there. So they were doing the surgeries, and this technology attracted me, and then I bought it and started performing. So in 2014, 21st November, today is 22nd of November. So around 10 years back, I performed first attune knee. It was a bilateral attune knee PS design in Sahaj Hospital, where that Arthros clinic started. And then gradually, not all patients were able to afford the attune at that time. It was very costly. So most of the surgeries which I was doing was a Sigma CR150, and it was a cruciate design with a high flexion. And nowadays it is recalled by the company, but the patients are really doing very well. So it's a small video of navigation surgery. Probably few of us have not seen the navigation because it is old technology, but still it is useful in all the robotic system which we are working today. So there are these are the basically the instruments of the navigations. Not much instruments are needed, and whole of the surgeries are performed by these instruments, and only the 2 zigs by which we take the cuts. So first of all, these reflecting markers are fixed in the proximal tibia and distal femur, and then the registration process is done. So this joint I have done for a patient who has an extra-articular deformity, and this is the registration process, acquiring the center of the hip by circumduction of the hip joint. This is for the center of the distal femur to get a longitudinal axis of the femur. Then the medial and lateral epicondyles, and white side line. Then this is the morphing or the painting which we are doing on the medial as well as the lateral femoral condyle, so that we get either the distal most part of the condyles and the posterior most part of the condyles. And then after getting this, we do it onto the anterior surface of the femur here. So by this and the posterior, we get the size of the femoral component, and then after registration, we verify whether the points are acquired properly or not. Similar procedure is done in the tibia. So by taking the most prominent point of the medial malleus and the lateral malleus, we take the center of the ankle joint. Then we take the center of the tibia and medial and lateral tibial plateau, medial and lateral tibial orders for the tibial size, and then we move it for the first time and see how the joint is there, whether it is it is a lax in flexion or tight in the flexion. All those information we get it, and then we take the cuts. We need to fix these jigs as per the plan. We get into the navigation, and after cutting those things, we can have a trial and we can see how the implants and the joint is stable or not. So this was a very simpler technology, easy to use, and still I am having it and use in many of my cases. And nowadays I use this navigation as an open system when I need to perform it for the other implants. So I use the navigation for those things. And then with this navigation, since it was a portable, I carried it to the Jabalpur, I carried it to the Bhopal and various places using the navigation and its surgery. I even did high tibial osteotomy surgeries with the help of navigation. And now I use this navigation as an open system for other implants also, because the Wellness is limited with the attune system. So then after that I switched to the Shelby, and then I performed almost all cases by conventional method. So doing conventional surgery after doing navigation or robotics, I feel myself a little more wiser conventional surgeon than I was before doing the navigation. So navigation and robotics gave me an idea of better understanding about the ligament balancing and how the things can be managed using by rotating the implants and all those. Then in 2022 I joined CARE, and in 23 we got a Wellness system over there. So I took training of the Wellness on the sawbones and the cadavers, but I also tried other systems like the Cori, Cubis, Mako, and I personally felt that this Wellness system is very simple. The simplicity of this symbol makes us easy to use, and if it is easy to use the technology, then the person is more comfortable, and more cases they can do with the robotic. Because I had an experience of doing navigation, it was very easy for me to opt this Wellness. So once I got the Wellness, I have to do attune. Most of the cases I am doing attune, because attune is a very good design as per my opinion, and we use the patient specific surgical techniques. We can use the type of alignment, mechanical, kinematic, restorative kinematic, and those things, they will improve the patient satisfaction, and ultimately the patient satisfaction is the thing which matters to all of us. There is a small video of Wellness robotic surgery. So first of all, we open it. Our approach can be anything, middle parapatellar or subvastus or midvastus. Then we remove osteophytes and releases, but whatever we want to do, we do it initially. We do less releases because most of the things can be controlled by the rotation of the components. And after putting these reflecting markers, the registration process is done as it was done in the navigation. Even the points are lesser in comparison to navigation here in the Wellness. Only the relevant points are there, which makes the difference in outcome. And once the registration is done, then we move the joint and see the ligament status and the gaps, how it is, whether it is tight in flexion or it is tight in extension, whether it is tight medially or laterally. All those things are checked, and that is planned accordingly, and then the cuts are taken with the help of robotic saw. The advantage of robotic saw is the execution part. So the navigation part was limited to the planning, and here the system helps us in execution also, so that we can get a proper balancing of the implant. I don't mind 1 degree or 1 mm loosening or tightness in the joint, but I try to be more of restricted sort of kinematic or a mechanical sort of implant, because I'm very much convinced with the mechanical alignment system for the past few years. But nowadays I am more focusing on the ligament balancing, and then we do it, and we trial it, and then finally implant the joints. So nowadays I use Attune because it has some features which are exclusive in this implant and which are more useful for the patient, and it is anatomically more correct or anatomically more sound and feels natural to the patient. Thank you.